Mental Health Services of Southern Oklahoma. Yes, we can help.
Robert Lee, Executive Director of Mental Health Services of Southern Oklahoma. Regardless of whether we're going to meet all your needs or not, if you come in our door, we want to be a part of the solution. We are the premier provider of behavioral health services in Southern Oklahoma when it comes to the delivery of services to those individuals who have a severe and persistent mental illness. We cover all aspects of behavioral health, but our specialty is those people that have schizophrenia, bipolar disorder, major depression, children that have serious emotional disorders. Those disorders that other people find very complex are our specialty. This organization has been around in Southern Oklahoma since 1954. It started out as a child guidance center, and in 1974, I believe it was, actually reorganized as a community mental health center, contracted with the state of Oklahoma for the 9 counties that we serve. And those 9 counties include Garvin, Murray, Carter, Love, Marshall, Johnson, Bryan, Pontotoc, and Seminole. So we cover a large area, about 250,000 people. Our principal clinics that we operate are in Ardmore, Ada, and Durant. We have unit coordinators that operate on site for the oversight of each of those agencies. Then we have smaller clinics in Pauls Valley, Tishomingo, and Seminole. Other than this population that's served, each clinic provides the same range of services. We're the only provider in Southern Oklahoma that actually has a psychiatrist, more than one psychiatrist available, both that are trained as adult psychiatrists and child and adolescent psychiatrists. So we provide that first layer of treatment, which is medical intervention for psychiatric disorders. Individuals who come in to see our psychiatrist are actually going to be on a real-time, high-speed connection using a very confidential T1 line so that there's no breach of confidentiality, so that they can speak to and see and be seen by the psychiatrist in real time. It was very difficult to maintain psychiatric services because physicians would have to drive to our clinics, either from Norman or Oklahoma City. There are no psychiatrists who are in practice in Southern Oklahoma, so we had to import them from other areas of the state. It wasn't efficient or necessarily effective. We initially started looking at what our options were for developing a telemedicine network, and in fact, Mental Health Services of Southern Oklahoma is one of 2 rural community mental health centers that was at the forefront of implementing this process in Oklahoma. So we've been a real leader in that area.
Evelyn Southers. I'm a behavioral case manager at the Ardmore Clinic, and I work with a variety of clients at the clinic. One of my programs that I enjoy the most is the children's program, facilitating a day camp for children that have special needs, working with children and their families and providing them an opportunity to grow, do well in school, do well at home and in the community. I also do adult groups as well, and that's particularly what I do here. I do group facilitation. I believe that groups give you a whole new perspective on how to recover and to move into recovery mode, whether it be trauma related, whether it be understanding mental illness, whether it's just understanding that you're not alone.
My name is Pam Kirkstra, and I'm the program manager with Systems of Care for Mental Health Services of Southern Oklahoma. We provide a service called Wraparound for families. It's called Wraparound because I think that's actually what we're doing. We're wrapping around the family and providing this service to help them have a voice. So many times when you're involved in multiple agencies, what ends up happening is the family feels that each agency or each professional involved with them has an agenda for that family that might not be the family's agenda. We help the family to do a really neat thing called a Strengths, Needs, and Cultural Discovery, which is a document and actually a story about the family. One of the things I like best about that is the family can voice their needs, but we can also show what kinds of strengths they have, how their culture impacts how they view their family, and then when we deliver services, we're sensitive to those things.
I'm Jackie Williams, and I'm the Drug Court Program Manager at Mental Health Services. And what we do is we work with a team that, it includes the judge, the district attorney, the drug court administrative office, and then the treatment providers. And we provide substance abuse services. We meet with the team, decide what's best for each participant, and then we provide individual, group, whatever services that each individual client needs.
So we've got the full array of psychiatric services available at each of our clinics. We're like a multifaceted diamond, but if you look at that in terms of how a diamond's cut, a big part of that is going to be our medical services. But all those other services are more successful because we have the medication available, and the medication's more successful because we have all those other services available. Both of those combined really set us apart. The biggest misconception about mental illness is that it's rare and it's other people. The individual is working at the highest level of their potential in a community that's supportive of them and able to engage in relationships with others that is as normalized as possible. So if we can do all that, I'm calling that a success. We all have mental illness in our families. We know someone who has a mental illness. Depression is a mental illness. 20% of the population at any given time has a diagnosable mental illness. 2% of the population has a severe mental illness like schizophrenia or bipolar disorder, maybe up to 5%, but at least 2%. So we're looking at dispelling myths that have to do with dangerousness and rarity. People who have a mental illness are frequently perceived as being dangerous when statistically we know that as a group they are less violent than the general population. The other thing I would want them to know is that mental illness is a children's disease. Half of all disorders, their first episode of mental illness is by age 14. 75% of all first episodes of mental illness occur by age 24. So this is a children and young people's disease. And the earlier we can get involved in treatment, successful treatment, the more likely they are to be able to recover and to have a successful life. What I want people to know is that if they have a choice to make about where they're going to go for behavioral health services, that they would experience this organization as one that would be their go-to place, that it would be where they would think of in terms of seeking treatment for them or their loved one for behavioral health services.
Mental Health Services of Southern Oklahoma. Yes, we can help.